Skin cancer is very prevalent in Australia.
Yes.
I mean, what are the different types of skin cancers?
Yeah, it is very common in Australia, and there's probably three main types we see. One's a basal cell cancer, squamous cell cancer, and melanoma. Basically, I get involved in the ones that are either more severe or in more complex cosmetic sort of areas. Basically, a lot of general practitioners and general surgeons can manage skin cancers, but really when they're on the face or more involved is when I get involved, basically applying more complex plastic surgery and reconstructive type procedures to it.
I mean, is it quite common for people not to know that they've got sort of a
Yeah,
skin
it is.
cancer?
Yeah, often that's picked up just by general surveillance by their general practitioner or their dermatologist. Maybe a partner or spouse might have pointed out something that's changing, and then they go and see it, and they're actually quite surprised when it comes back as a skin cancer, because some of them are fairly indolent. They've been there for 12 or 18 months, not doing very much, but slowly growing. Then it needs obviously a proper resection to treat it properly. Often it's a bit of a challenge for people because they've come in, they haven't seen very much, and at the post-op appointment the incisions are often longer than they were expecting. But really they're designed so that long term, as the scars fade, as minimally detectable as possible.
I mean, it must have a big impact on their life, especially if it's something quite visible, for them to have that skin cancer.
Yeah, that's right, and especially that's why it's important, to use all those techniques, because if it's on the face, around the eyes or nose, and obviously that's a very public place where you interact with different people, so it's important to primarily get rid of the skin cancer, but also reconstruct it in the best place as well.
Great.